Atrial fibrillation ablation, the purpose of that procedure is to try and minimize the symptoms of atrial fibrillation. We believe that the triggers of atrial fibrillation begin in what are called the pulmonary veins. These are blood vessels that drain blood from the lungs back into the heart. There are some abnormal signals that we believe occur in most patients with atrial fibrillation, particularly with the intermittent form. We believe that those signals can leave these pulmonary veins, enter the heart to cause atrial fibrillation. Cryoablation and radiofrequency ablation have the same goals, and that's isolating these veins from the rest of the heart such that these trigger points cannot enter the heart to cause the atrial fibrillation. Radiofrequency ablation utilizes what's called a point-by-point strategy. This is using a catheter like a pencil or a pen, where we take a point and then another point and then another point, and we connect these ablation dots all around the opening of each of the 4 veins. The delivery tool for the cryoablation, the technology is different, and so instead of using a point-by-point method, we actually just take a balloon and we push it to the opening of these veins and freeze around the entire opening of the vein, or what we call the circumference, at the same time. So the goal is the same, the energy sources are different, but right now the biggest difference is how do we deliver that energy to the patient to create the same outcome, whether we're using a freezing or cautery technology. So the procedure takes about 2 hours. The patient should expect to have some testing prior to the procedure. Sometimes they have a CAT scan of their heart so we can identify these veins and see how they drain the blood back into the heart. On the day of the procedure or before the procedure, sometimes we take a look down the throat and make sure there are no blood clots within the heart. That's called a transesophageal echocardiogram. On the day of the procedure, the patient is oftentimes under anesthesia. It's a minimally invasive procedure, and so we start by going in through the groin area, sometimes on both sides, sometimes just on one side. Wires and tubes go up to the heart. When we put these wires up to the heart, we go ahead and we do our procedure. It's done with this cryoballoon technology is done with nitrous oxide, which fills up this balloon. The balloon gets very, very cold as it touches the opening of these veins. Everything is removed afterwards, the tubes, the balloon, nothing is left within the patient. The patient wakes up. They do have to lay flat for about 4 to 6 hours after the procedure. After that, they can get up and walk around. They can have dinner or a late lunch. And then by late that evening or the next morning, they can be discharged home. It does take about 2 to 3 months to see the final and full effects of the procedure while everything is healing where we've worked. And so during that time period, we do continue blood thinners. And if the patient is on other medications, oftentimes those medications are continued while things are healing. Of course, a patient can get back to regular activities and work within just a week or 2, sometimes much earlier than that, depending upon their specific circumstances.